Thank you for joining us today at the Alliance for Healthier Communities 2021 conference. The following presentation is dedicated to Denise Brooks, her legacy, her commitment to Hamilton Urban Core, and the community it serves. It was an honor to work with Denise throughout the planning of this new center, and I feel fortunate to now be a part of the team working towards seeing her vision realized. Hello, my name is Jamie Cook. I'm a senior project manager with Colliers Project Leaders. I'm joined today by Nadine Favics, Office Administrator, Hamilton Urban Core Community Health Center, and McMichael Ruth, Principal at Architects Tillmann Ruth Robinson. Today, we're here to talk to you about how Hamilton Urban Core focused the design of their new community health center on creating inclusiveness for their diverse community, which includes marginalized and racialized groups who often experience discrimination in healthcare spaces. They wanted their staff, clients, and visitors to really have a sense of belonging and a pride of place. They also wanted to encourage collaboration among their service providers and their community partners. So to start us off, I'd like to ask Nadine, why was it so important for you and the Hamilton Urban Core team to use design to create an inclusive space?
Thank you, Jamie. I think most of the people here know that Hamilton Urban Core is one of the most marginalized, if not the most marginalized community health center in the sector. And as such, our clients have had to adjust to our current space, which is absolutely lacking in every sense of the way. The new design acknowledges that not all spaces are inclusive and accessible. So we wanted the new center to be the most accessible as possible, and considered things like physical accessibility first and foremost, but also the understanding of the lived experience of the clients who would be accessing the center. And so accessibility needed to be important from the threshold of the building to the exam rooms. We also feel that it was an opportunity to actually live the model of care and of health and well-being in the community health center approach. And so we've developed care pods so that the providers actually will be coming to the clients, and the clients don't have to go all throughout the building to, it's just one point of access for care. So those are some of the things based on the feedback that we received from the clients over the years in this journey.
Wow, so you can see there was a clear and specific vision for the new community health center. Colliers was engaged by Hamilton Urban Core at the beginning of the stage 2 business case in the community health capital planning process. This is an important stage in the process, but it's about listing programs and services, entering data and FTE numbers into an Excel spreadsheet. It's not about creating vision or being visionary. In order to help the ministry understand Hamilton Urban Core's vision, we needed to educate them on the vision, the what, the why, and the how, to help them move past their cookie cutter approach in order to gain space approval and ultimately implementation grant approval. One of the things that really stood out in my mind when working on the space request section of the business case, and very early on in that process, Hamilton Urban Core stated that it was necessary for the consumption and treatment services program to have a private exam room and not just an alcove in an open area or corridor, which is what was allocated by the ministry. Through constructive dialogue and education about what the clients actually need and what they actually are experiencing, Hamilton Urban Core was able to obtain ministry approval for this additional exam room. So McMichael, I know you have a lot of healthcare experience in this sector, and you use evidence-based design practices to ensure inclusivity. Can you share a few examples of how you did that for this project?
Yes, thank you, Jamie. Evidence-based design has proven that exposure to daylight reduces depression and pain, and that people experience less stress if they can view nature. In the design of the new Hamilton Urban Core Community Health Center, we ensured all gathering spaces and circulation spaces have direct access to daylight and views to the outside. This not only helps build a welcoming and safe environment for everyone where people feel comfortable to be, but it adds and works towards intuitive wayfinding throughout the building, where when leaving or entering spaces, direct access and a view to the outside will help orient visitors and clients within the spaces. This helps break down some of the more traditional and clinical environments that one might see in a community health center. Evidence-based design also shows that clearly legible and easily navigated spaces, such as those that are visually connected and easy to understand upon entering, will support accessibility and inclusivity. Given that the design of the new Hamilton Urban Core Community Health Center is a two-story building and offers access to many care providers and community spaces on both levels, we used a two-story entry and welcoming space to provide visual access to all components of the building upon entry. This allows for easy orientation and visual access to all of the spaces that both visitors and clients may be accessing when entering the building. And as Nadine mentioned, through intensive stakeholder engagement and listening to what the needs of the users were, we broke down the traditional silos of care providers and created multidisciplinary pods where clients would come in and be able to get access to several different care providers in one space. This really created an interdisciplinary approach and more of a pod-like care provider rather than individual zones of care. I would also like to mention digital equity was important. This is a welcoming space for all members of the community. So whether people are coming in just to get out of the cold and charge their phone, we've provided access to Wi-Fi and internet throughout the building and outside of the building. So anyone accessing the site can get access to internet at all times of the day and night. And then one thing that was very important for both the project and the community was to reduce the stigma of those who may be entering and getting access to the various services within the building, and to make sure it was as welcoming as possible. We created only one entrance to the building. So everybody is coming through one space in a truly equitable and accessible way, rather than creating multiple entrances throughout the building.
Oh, that's great. Nadine, I know that in the new building, you have been hearing from folks and listening to their feedback. Can you tell me a little bit about what you're hearing and some of the things that they're benefiting from right now?
So absolutely, Jamie, thank you. And thank you, McMichael. I think it's important for folks here today, if you don't know, but I think most do know, that this new center is the result of over 15 years of advocacy by Denise Brooks and the clients, staff, volunteers, and students who walked foot and foot with her for over 15 years to see this building come to fruition. The design is directly impacted by the feedback that the clients have given us over those years of the spaces that aren't accessible to them and the feelings that they have when they're in those spaces, or reasons why they won't attend those other spaces, and what it is that would make them feel comfortable. So as we're able to share illustrations and engage stakeholders in ongoing conversation, people are very pleased with the design and feel that it does illustrate what they've been talking about. And in fact, one comment was that they didn't realize it's what they were thinking about. So as we work together, we'll continue to engage, and the feedback from the clients is the most important to us, and we'll continue to form the final outcome until the day that we cut the ribbon.
I want to thank the Alliance for Healthier Communities for the opportunity to share our experience and thoughts on this important topic.